Are there any other votes? Announce the results.
Ayes 94, noes 30.
The bill is passed.
Assembly 2499A, Calendar 751, Mr. Bronson. An act to amend the state finance law.
An explanation is requested, Mr. Bronson.
Yes, Mr. Speaker. This bill is in response to the many New Yorkers across the state asking us to look for cost efficiencies so that we can lower the spending in the state and exchange also hopefully lessen the burden on taxpayers. What the bill specifically does is require that each time a state agency is anticipating that it's going to let a contract out to a consulting firm, that they do a cost analysis and be required to analyze whether or not it would be more cost effective to have the work done by state employees or more cost effective to have the work done by consultants. This requirement would kick in for every contract that would cost, under the contract, $750,000 or more over a 12-month period. That would be the threshold.
Ms. Corwin.
Thank you, Mr. Speaker. Would the sponsor yield?
Will you yield, Mr. Bronson?
Yes, I will, Mr. Speaker.
Sponsor yields.
Thank you, Harry. Yes, that $750,000 threshold is a recent amendment, correct?
Yes, it is. We amended the bill last week, as did the Senate, so that we had matching bills to come to the floor.
Okay, great. Thank you. And I want to thank you for bringing up an important point. Obviously, it's very important for the taxpayers to be able to, we spend their money wisely, and it is always important to do the most efficient contracting that we can. The question I have, though, is my understanding is we have a system in place already, and it's called the best value process, where it takes into consideration not only the bottom line dollar figure, but also the quality and the efficiency as well. Now, Finance Law Article 11 says that we do this for purchasing of services and commodities, and I'm just wondering why we would need to single out consulting contracts when we're already taking that into consideration with services.
Well, first of all, you may recall that this bill passed a number of years ago. We received a veto message, and in the veto message, it brought up the best value concept and that the quality of the services had to be considered. We have now amended this bill in response to the veto to include quality of services as part of the consideration. So it's not just the bottom line dollar. You also have to look at the timing and the quality under the current version of this bill. The reason that we need to do this is because the state spends billions of dollars every year, and that cost has gone up over the years in connection with consulting services. In addition, we've had a number of New York State controllers who have reviewed this issue and indicated that we could save hundreds of millions of dollars a year if we would make this determination. Those controllers are both Republican controllers as well as Democrat controllers. So it's both sides of the aisle.
Certainly, absolutely. And as I said, it's important that we make sure that we are good stewards of the taxpayers' dollars, and certainly that should happen on both sides of the aisle. But I guess I still have the same question in that you've amended the bill to be a little bit closer to the best value concept, because now you're looking not only at cost, but you're also looking at quality. But why would we need to do that already? Are you saying that that determination is not being done already? Because they must in some way be doing that. Otherwise, they wouldn't be able to come to that best value conclusion.
They are. This is a more in-depth analysis, because best value is a comparison of the consulting firm A and consulting firm B. It's not necessarily, and there is no requirement that there is a comparison with whether or not we use the engineering department in that particular agency. So this is slightly different because it's adding that cost analysis, that quality of services analysis to make sure that we're comparing private work done and the public employees doing the work.
So if this bill were to become law, then the agency would have to conduct two studies. They'd have to do the best value process, but they'd also have to conduct this as well?
Not at all. Not at all. This kicks in when they're anticipating that they're going to be letting the contract. So contractors will, if they submit the bids, they would be doing that analysis. But I would anticipate that what would really happen here is that a determination would be made on the public workers doing the work versus outside initially. And if you get over that threshold, then you go and you do the best value approach. But if you don't get over that threshold, you wouldn't have to do that.
Okay. You're raising the threshold to $750,000. I believe the amendment also requires that there would have to be a 10% or more savings by going with the contractor?
Yes. We have two situations where if it is 10% or more savings, then you have to do a business plan to lay this out. And the business plan then would be reviewed by the Comptroller's office. If it's 10% or less, you're permitted to do a business plan, and that also would be reviewed by the Comptroller.
Okay. Well, thank you very much. I appreciate your answering questions, Mr. Bronson. On the bill, Mr.
Thank
Speaker?
you.
On the bill, Mr. Corwin.
There have been quite a few changes to the bill since the last time we talked about it, and it does certainly narrow the number of opportunities that this would have to be undertaken. However, I am still very concerned about the amount of paperwork, the amount of analysis that would have to go into it. As the sponsor had pointed out, that this only applies when you reach that $750,000 threshold. So first, the agency would have to determine whether or not they're getting to that threshold. But second of all, they would conduct their best value analysis and also take this into consideration. Add on top of that the added analysis of the 10% rule, which means at that point you'd also have to incorporate other aspects such as complete business plans. We're talking about a significant amount of paperwork and bureaucracy that could go into this. What I would suggest, or maybe a recommendation, is instead of doing this where it would happen for every contract that is let in this value range, perhaps what we should do is have these controllers who've expressed a concern and conduct a single study evaluating over the past several years or a finite period of time to make that comparison as to how much over budget we really would have been. And that way we would give us a little more indication as to how significant of a problem this is and whether or not it would be worth undertaking so much more paperwork and bureaucracy to alleviate the problem. So at this point, I would recommend a no vote, but certainly I think this is a situation that we can certainly continue to investigate and try to come up with a less bureaucratic solution. Thank you.
Thank you. Read the last section.
This act shall take effect on the 90th day.
Clerk will record the vote. Mr. Bronson to explain his vote.
Yes, Mr. Speaker, to explain my vote, I would just want to point out to my colleagues that this is an issue that has been going on for quite some time, and I don't think we need to wait for more studies. We have a lot of analysis out there that says we could save money as the state if we were to engage in this analysis before we let out contracts. In 2009, the Assembly estimated that the state could save $250 million over 3 years by reducing the use of information technology consultants. In 2010, the State Senate Task Force on Government Efficiencies estimated that the Department of Transportation could save about $46 million per year if we implemented a similar policy. The federal government has also weighed in, and as I mentioned during the debate, the controllers over the years have also said this. I don't think we need to wait for a study. The evidence is there. We can save money if we do this analysis ahead of time. And because of that, I would encourage all of my colleagues to vote in the affirmative. I withdraw my request and vote in the affirmative. Thank you.
Mr. Bronson in the affirmative. Are there any other votes? Announce the results.
Ayes 91, noes 28.
The bill is passed.
Assembly 4040A, Rules Report Number 124. Ms. Robinson, an act to amend the Administrative Code of the City of New York.
A explanation is requested, Ms. Robinson.
Thank you very much, Mr. Speaker. I'll be very pleased to give an explanation. This bill would require New York City Department of Buildings to provide written notification to owners of adjoining property at the time the application for approval of construction documents and permits are submitted to the New York City Department of Buildings. The bill would also require the New York City Department of Buildings to provide proof of insurance together with the permit to the adjoining property owners 30 days prior to commencement of construction, excavation, or demolition work, except in the event that emergency work is authorized. If emergency work is necessary, such documents would be required to be provided to adjoining property owners within a reasonable time frame.
Ms. Cohen,
Thank you, Mr. Speaker. Would the sponsor yield?
Yes.
will you yield, Ms. Robinson?
Yes.
Ms. Robinson yields.
Thank you. This applies only to New York City, correct?
Yes.
Okay. And do you have any sense in the bill of a distance, adjoining properties within 500 feet or anything like that? They must have an adjoining wall or shared common structures?
Adjoining walls.
Okay, adjoining walls. Mm-hmm. Okay, so if someone is excavating next to a condo building, would that require them to come up with liability insurance for every condo in the building that's next to them?
I wouldn't think it would apply for every condo in the building, but for the adjoining wall, that would perhaps be compromised as a result of any work that might go forward.
Okay, so maybe just the condos that are on that one side.
Yes.
That's it. What about if there's a vacant lot next door? Would they have to provide liability insurance if there's a vacant lot next door?
It depends upon if that vacant lot is compromised in some way. Let me give you an example. I just had some work was done next door to my property. And as a result of that, my adjoining wall was rather shattered. In addition to that, it had been committed to a lot of power washing because of the building outside, so a lot of water damaged my property. So what happens is the dirt, the foundation of that building is compromised. So as a result of that, they would have to show insurance because someone owns that property.
I see. Okay, thank you. And getting back to the condo owners, so say there's a dozen condo owners along the common wall.
Along that common wall, if they have to pay for any kind of repairs, then that insurance would be able to cover that compromise of the property.
I see. And so then proof of insurance would have to be provided to each of those 12 people or
That's
however
correct.
many were on
That's
that
correct.
common wall. Okay, great. Well, thank you very much. I appreciate it.
Thank
you,
you.
Mr. Speaker.
Ms. Glick.
Very briefly, I just want to thank the sponsor for bringing this bill forward. We have had numerous situations in my district where excavations have undermined the foundations of adjoining properties. Damage has been done. People have been forced out of their homes, vacate notices. The Department of Buildings, the fire department, the police department have to arrive and deal with very significant challenges for the people who were in the building that wasn't having any work done on it. And so the dislocation of individuals, the cost to the city in each instance, when there's an emergency situation that has arisen, we've had some building collapses, and we've had the undermining of adjoining properties, some of which were condos, and the building had to go and sue the adjoining, the construction company, et cetera. This is a great bill and very, very important for people who live in the city of New York because we have properties right next to each other, and in some districts, older properties, which are even more susceptible to vibration of these new, larger pieces of equipment that are coming in to build very much bigger buildings than had previously existed next door. So thank you so much, Mrs. Robinson. This is extraordinarily important legislation.
Ms. Robinson?
Yes, I'd just like to say that in the community, there's a lot of demolition, there's a lot of excavation going on, and people within the community that I represent have experienced a lot of compromise of property. As a result of that, people are telling me, they can't shut their doors, the buildings have shifted, or something's happened, something is falling off of their property. As a result of that, when they go to the various contractors to complain, many of them, they're pushed off. So therefore, I said that, perhaps we need to do something differently to be able to provide for some relief. Because what happens is once your building starts to shift and other kind of things happen to your building, sometimes you're not always able to pay for the damage and the repairs. So therefore, that's why it's so important that those that are doing the excavation work or contracting work, whatever they're doing, that they should have a responsibility to remediate that person's property. So with that being said, I want to vote in the affirmative on this piece of legislation.
Read the last section.
This act shall take effect immediately.
Clerk will record the vote. See if Ms. Solange is in her seat when you go down and send her up. See you ask for it. She begged me.
Mr. Castorino to explain his vote.
I'd like to thank the sponsor on this one. As a litigator, I've had the opportunity to represent clients with issues exactly on par with what Ms. Robinson's speaking about, particularly in Brooklyn where there are row houses that were built in the 1920s or so, and then somebody comes in and wants to tear it down and put something else up. And you have issues with underpinning and undermining of foundations and causes lots of harm, lots of property damage, and also issues with water infiltration and mold. So this is a good bill, and I'm proud to support it, and I thank the sponsor.
Mr. Castorino in the affirmative. Mr. Perry to explain his vote.
Thank you, Madam Speaker. I rise to speak in support of this bill to explain my vote. And I want to take the opportunity to thank my colleague, chair of the Banking Committee, who introduced this bill. And I think this just says a lot to what we will miss when she's not here next year. This is very important, very significant, well thought out piece of legislation that people who own homes, like one I do, that's connected to another home owned by another owner, if they wish to do any construction or anything that might be disturbing or affect my property, I get proper notification. That is indeed something that's good public policy, that we put it in statute and require that owners be appropriately notified. I withdraw my request, Madam Speaker, and vote in the affirmative.
Mr. Perry in the affirmative. Are there any other votes? Announce the results.
Ayes 118, noes 0.
The bill has passed. The clerk will read.
Assembly 59, 55B, Calendar 225. Ms. Rosenthal, an act to amend the public health law.
Explanation has been requested. Mrs. Rosenthal.
This bill would add electronic cigarettes to provisions prohibiting smoking in public places.
Mr. Rea.
Thank you, Madam Speaker. Will the sponsor yield for some questions?
Will the sponsor yield?
Yes.
Hi, Linda.
Yield.
It's another year. It's another e-cig debate. In your explanation, the bill actually goes a little bit further than just adding e-cigarettes to the Clean Indoor Air Act in New York State, correct?
It also exempts retail electronic cigarette stores from this prohibition, yes.
Well, Section 4 adds a new public health law to require any person selling or offering for sale electronic cigarettes that is not registered with the Department of Taxation and Finance to sell tobacco products. They now have to register with the Department of Health, correct?
That's actually been amended.
Ah, okay. So that's out?
That's removed, and that was in a previous bill.
Thank you. Things change here so quickly. So we're just strictly sticking to the Clean Indoor Air Act?
Correct.
Okay. Well, I'll start with an easy question, maybe. Why are we adding this to the Clean Indoor Air Act? I thought it was easy.
There are a number of reasons why e-cigarettes should be included in the Clean Indoor Air Act of New York State. One reason is that we are concerned about unintended exposures to electronic cigarettes, especially to non-users. So, for example, in some counties, you can go into a restaurant and use an e-cigarette while you're sitting and eating your dinner. That, number one, infringes on the rights of the people near you not to have to inhale that vapor, but it also makes it hard to enforce the law because cigarettes are not included there, and here you have e-cigarettes, so it makes it harder to enforce the regulations. E-cigarettes are not emission-free. They include nicotine, aerolin, formaldehyde, cancer-causing chemical and irritant acetaldehyde, which contain harmful carcinogenic metals like cadmium, nickel, and lead. Those are just some of the reasons.
Are you referring to a specific report that's saying that?
This actually is from Roswell Park Cancer Institute, where the foremost researcher on e-cigarettes is employed and is considered one of the experts in this country.
Well, because I have a recent study from Drexel University School of Public Health, and a study just released by Professor Igor Bernstein, Drexel, blah, 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 blah. This is the first definitive study of e-cigarette chemistry and finds that there are no health concerns based on generally accepted exposure limits. By reviewing over 9,000 observations about the chemistry of the vapor, and I say vapor because we're not talking about smoke here. There's not a fire that's associated with this. When just talking right now, vapor is coming out of my mouth. Some would call it hot air, but it is actually vapor. So they reviewed 9,000 observations about the chemistry of the vapor and the liquid in e-cigarettes, and Dr. Bernstein was able to determine that the levels of contaminant e-cigarette users are exposed to are insignificant, far below the levels would pose any health risk. Additionally, there is no health risk to bystanders. Proposals to ban e-cigarettes in places where smoking is banned have been based on concern there is a potential risk to bystanders, but the study shows there is no concern.
Well,
So I see your study and raise it with mine.
Well, I repeat, my study is from Roswell Park Cancer Institute right here in New York State. I would rather trust a New York State institute than one outside of this state.
Well, the CDC, let me find it here. Mitch Zellner, from the Food and Drug Administrator's chief tobacco regulator, put it this way. Smokers smoke for nicotine, but die from the tar. The tar comes from when you actually burn the product, and the tar is not in the vapor. So, again, you're dealing with two. In fact, well, the CDC came out with a recent report. They're starting to regulate this. I know we talked about it last year. I guess they're still not done, but initially, have they made recommendations to add this to Clean Indoor Air Act?
Actually, the FDA is now regulating e-cigarettes under their responsibility to regulate tobacco.
Correct.
So they have said, and this is the way it goes, it's up to the states to regulate where e-cigarettes are used.
Okay.
Nicotine is a poison. It's harmful. There are other chemicals in e-cigarettes. And let me add that if you want to use e-cigarettes in your home, in your backyard, this does not stop that practice. This just includes it in the places where cigarettes are not allowed.
Okay. Well, currently, so the feds want to leave it to the states. It's my understanding that a number of local governments have already implemented bans in public places, correct?
Mm-hmm. That's absolutely true. 8 counties and New York City, Albany, Cattaraugus, Erie, Putnam, Rockland, Suffolk, Tompkins, and Westchester.
So then why do we need to even get involved with this?
Well, that's about 70% of the state, and it's really advisable when you have a law like this that it apply uniformly throughout the state.
Well, uniformly, it's either you ban it or you don't ban it, but ultimately, local county health departments are the ones charged with the responsibility for enforcing this, correct?
The state can also do the ban, which is what we're proposing.
I understand, but who, in other words, if we ban electronic cigarettes and somebody decides to smoke one in a restaurant, who's responsible for enforcement?
It would be local enforcement.
Correct. So it's the local governments that should be taking priority over this.
Just as they enforce the ban on cigarettes under the Clean Indoor Air Act, this adds e-cigarettes to that responsibility.
So that's the local health sanitarian that's charged with the responsibility for enforcing this, correct?
The local health department, yes.
Well, they're called, the actual enforcement agents are called health sanitarians. These are the same people that are also charged with the responsibility to make sure that the food you're eating doesn't kill you. They're also charged with the responsibility to make sure that kitchens are clean. These are, in fact, the people that give the grades that you see on the outside of many windows. They're not law enforcement officials, and essentially you are asking them to be just that. The other problem with that is I know of no county where health sanitarians work after 5 o'clock. Most people are in bars and restaurants after 5 o'clock.
Okay.
Excuse me, we're going to pause the debate for an announcement for Mr. Murray.
Yeah, I apologize. If I could just ask members of the Rules Committee to meet in the Speaker's conference room while this debate continues. The Speaker's ready for members of the Rules Committee.
Can I vote with the chair in the Rules Committee, seeing how I'm here debating right now?
I'll be happy to pass it along.
Thank you very
Thank
much.
you.
So, getting back to that,
when we pass laws here, they're the law. So you run your own risk if you choose to violate it. The same thing with you cannot smoke in a restaurant, whether the health department inspects at 11 a.m. or 11 p.m. The same rules will apply to e-cigarettes. It's really simple.
so it's another one of those self-enforcing laws that we
Actually,
call.
county health officials support this bill. 10 states have this bill in place. It really is just common sense and good health.
Well, see, I view it differently. The studies I've seen show that it's not nearly, or in many instances, has no impact on as secondhand smoke would. I also see this as a smoking cessation device. There are numerous studies that I'm not even going to get into that show that this uses about as much nicotine as a patch that many people use.
Actually, because they're not labeled and because we do not know how much nicotine is in each e-cigarette, you can't really make that claim.
Well, but the CDC is actually taking care of that right now, right?
The CDC, I didn't hear your question, but actually different brands produce e-cigarettes with different levels of nicotine.
Correct, and the CDC...
And in terms of using e-cigarettes as a tobacco cessation device, be my guest, go do that. If that helps you quit smoking, go ahead. But you cannot do it under this bill, under the Clean Indoor Air Act.
Okay, I understand. Well, I guess we're going to have to agree to disagree. And I have a feeling we'll be back again next year having the same conversation, unfortunately. But, Linda,
well, maybe not.
Thank you for your time, and I appreciate it.
Okay, I'd just like to tell you that the Drexel University study was funded by tobacco interests. So once again, I rely on our Roswell Park study.
Well, okay, since we're going to continue on studies, hold on. The Royal College of Physicians, that's kind of the British version of the CDC. And in fact, the Royal College of Physicians, they identified the negative aspects of tobacco smoke back in the 60s, well ahead of the United States. And they have similar results with respects to exposure. And in fact, the ultimate recommendation of their report is that electronic cigarettes should be promoted as widely as possible as an alternative to smoking.
So if you want to move to that country and live under their rules, be my guest. Here, the World Health Organization does not agree with that. The CDC does not. The New York State Health Department, the U.S. Preventative Task Force does not. So I'd rather stick with more local and national sources than a source from another country.
Fair enough. Thank you, Linda.
Mr. Rock?
Thank you, Madam Speaker. I was concerned for a second there, Mr. Ray, was going to start speaking in a British accent. So, would the sponsor yield?
Will the sponsor yield?
Yes.
Yes, the sponsor yields.
Thank you. So just a couple questions just in general on what we're trying to accomplish here. I think, the previous speaker covered a lot of the technical issues and what e-cigarettes are, but, I mean, what is the intention in your view of the Clean Indoor Air Act?
Well, I think it's just what the title is, to ensure that people have clean air when they're indoors.
So it's really then intended to ensure, that the non-smoker is breathing clean air, that they're not being subjected to cigarette smoke, or should this bill pass, the vapor from an e-cigarette.
I mean, the stated purpose in 2003, when New York State strengthened the Clean Indoor Air Act to remove smoking, was so that workers would not have to be exposed to the dangers of secondhand smoke. And e-cigarettes were not in existence at that time, so we're just trying to catch the law up to what the reality is in 2016.
Okay, so should this bill become law, then e-cigarettes would just be treated for purposes of the New York State Clean Indoor Air Act in the same way any other smoking a cigarette, smoking a cigar, smoking any other thing in an indoor place, correct?
Yes.
Okay. Now, do you feel there's a difference, though, between cigarette smoke and the vapor that comes off of an e-cigarette?
Well, a number of studies have examined the content of e-cigarette aerosol, and there's propylene glycol, there's nicotine, there are flavorings, there's heavy metals, volatile organic compounds, other potentially harmful chemicals that I personally do not want to be exposed to, nor do I think children, people with compromised immune systems, should be forced to inhale or to sit next to. There's no reason that a person's use of e-cigarette has to affect the air and health of someone sitting next to them.
Sure. Okay. And earlier you mentioned that, because, I mean, the argument I might make with regard to this is that, I think that it's proper to regulate this. I would agree that, trying to protect individuals who don't want to be exposed to whatever chemicals may be in there is a good thing. But I also think that there's differences between the two that might lend themselves to maybe being slightly less stringent regulation of an e-cigarette. You mentioned earlier, though, that you believe this adding this would aid in enforcement. Can you elaborate on that?
No, I'm saying it right now, in places where one is allowed to use e-cigarettes indoors, the waiter, the waitress, the restaurant manager will not definitely be able to see if the person's using a cigarette or an e-cigarette. So it takes their time. It causes an incident. They have to come see, what is it that you're using? So to make it much more simple for enforcement reasons in these indoor areas, it's best to have no kind of smoke or vapor used inside.
But they could just, I mean, have a sign or tell their patrons in general, you're not allowed to use these within their establishment, could they not?
Well, right now they say you're not allowed to use cigarettes, but they are allowed to use e-cigarettes. So
Under the law, but
yes.
could an establishment not say, look, we're not going to allow people to use these? Our other patrons are concerned, they don't want to be breathing in whatever's in them. Could that establishment not just tell people they're not allowed to use them within their establishment?
You know, that's a voluntary system. That's how the system was set up when people smoked cigarettes everywhere. That certainly does not take care of every indoor space where cigarettes are used. So voluntary is nice, but it doesn't cover every arena that we're trying to cover here.